Should we be zapping our kidney nerves in order to control high blood pressure? Let me know in the comments what you think after having a watch of this. So, this is not kidney beans, these aren't giant kidney beans, these are pictures of kidneys. We have two kidneys. So I'm going to tell you a little bit about kidneys, the kidney function with high blood pressure, the potential role that zapping the nerves can actually bring to millions of, well, hundreds of thousands of people possibly, but what are the risks? We don't know. And what are the alternatives? What's perhaps a more sensible way to approach this before doing such drastic things? Now, your kidneys. Okay, your kidneys are there to filter out lots of rubbish and also to keep what is needed. Now, one of the most important things is sodium. Our body needs sodium. Without sodium, we will die. It's quite simple. And so there are lots of feedback mechanisms given to help us retain sodium. And if we don't get enough sodium, what happens is our kidneys basically say, hey, we need to retain sodium, and we've not got enough sodium. So if we haven't got enough sodium, we can't get water and we can't suck hydration into our blood vessels. So what happens is our blood vessels contract, and this puts up blood pressure, because if we can't get blood to our brain, or oxygen, we're going to have a very bad time. So there's a reason why this mechanism between our kidneys and high blood pressure exists. It's there to protect us so that we can actually function when we haven't got enough salt, because in the wild we're more likely to run out of salt than actually have too much salt. However, in today's society we tend to get too much salt, but a lot of people, they lower their salt, they still have high blood pressure, because there are lots of other reasons why we can get high blood pressure. There's about 90 that I've identified so far in my research, and that's not just me researching, that's actually just me actually going and researching the research that's already there. I've written a short book on blood pressure already, and I am always bewildered by the fact that when I ask my patients who are coming to me in pain, or they just want to get healthier generally, what have their doctors done to find the cause of the high blood pressure? The most common answer is, oh, it's just familial, which is actually just, it means they haven't looked, they haven't really tried. And the same thing is going to happen with kidney denervation. So many people are not getting control of their blood pressure through medication alone because the underlying causes are not being fixed. So now that it's been developed for about 10 years, so what we're going to do is we're just going to zap the nerves that come from the kidneys, the sympathetic nerves that basically are the ones that are stressed out saying we need to raise the blood pressure. However, it is possible that it could be low sodium that is causing this problem. And so often I will see low sodium on a blood test, but the doctors are ignoring it. And instead of actually saying, well, maybe we should try increasing sodium in your case and see if your blood pressure goes down again, because it does happen. But you've got to actually look, have you actually got low sodium in the first place? Because if you've got low sodium, you need to probably increase it for your kidneys to work properly. However, most people's kidneys are getting dysfunctional because of what's called the renal acid load, too much acidity. And most people are getting too acidic because they're having too many high acidic foods like roast chicken and carbonated drinks, and not enough acid lowering foods that are high in potassium. Now, potassium, a lot of people with high blood pressure know that basically a lack of potassium causes high blood pressure, among other things. But when your kidneys are really dysfunctional, too much potassium can be bad. So once your kidneys are already destroyed because of the fact that you didn't have enough potassium, too much potassium is going to cause a problem. So you can't lower your blood pressure through increasing potassium anymore. However, most people, their kidneys aren't so dysfunctional where they can't actually take more potassium. And so actually having a high potassium diet, as long as your kidneys aren't already so dysfunctional, will actually help your kidneys and will also help lower your blood pressure as well. So I've put together some simple, diet plan for both high potassium and also, if you have got kidney dysfunction, a low potassium meal plan to actually help the kidneys. There are nutrients that can help with the kidneys, but before I actually go and blurt out different herbs and things that are good for kidneys, it's actually good to know all the other medication, all the other things that you get going on, because it could be that medication you're on for something else is what's destroying your kidneys. Like, for instance, paracetamol, because you've been in chronic pain for years and you've never been to a chiropractor or an osteopath or a physiotherapist or a massage therapist or a nutritionist who can look at the whole pain dysfunction and solve your pain so that you don't need the kidney destroying paracetamol or other drugs. Now, the other thing that is very often ignored when medical doctors look at your kidney report is the fact that we know, for instance, that most people can live with only one kidney, which is why you can donate a kidney. And the reason that we have two kidneys is because even though we only really need one, it's kind of important that we actually have. Why would our body give us such huge amounts of backup if we only need one? And so in our blood, so here's a blood vessel, okay, your blood kidney markers will still look fine even though you've completely lost one kidney. So even if you lost 50% of your kidney function, your blood markers will still be fine. And so there's nothing wrong with your kidneys according to just looking at a blood test. So this means if there's even a very slight, like 1% decline in kidney markers in your blood, you've already lost more than 50% of your kidney function. But in order for doctors to start becoming alarmed about your kidney function on blood tests, you've probably got to have lost at least 70% of your kidney function, or even more, for it to actually show up enough in your blood test for doctors to think you've got a kidney problem. My advice is don't wait for doctors to tell you you've got a kidney problem. Okay, if you've got a kidney problem, then speak to them, talk to them about, high potassium, low potassium, which is going to be the best. But look at doing things that are going to alkalize your system to help keep your kidneys happy, because alkalizing and high potassium, these things, there are other things that help alkalize apart from potassium, but there are lots of things that you can do to help protect your kidneys, keep your kidneys healthy so that they don't cause problems with your blood pressure. But it's also likely that your kidneys can be brought back to life again with the right diet and nutrition, and therefore also your blood pressure is under control and you don't need to zap the nerves, because we don't as yet know what the long-term consequences of zapping these important nerves that are giving feedback between your kidneys and your brain. They're there for a reason. We only want to get rid of them once we know that there's nothing else that can be done. And unfortunately, medical doctors, they don't have the time to investigate all these other things, which is why giving drugs and doing procedures is so simple. And most people, they want a simple answer. They want, can you give me a pill? Can you do a procedure? Don't have to think about it. And they don't think about the consequences. But more and more doctors, the ones that I work with, are realizing that, you know what, instead of just jumping to pills and procedures, let's actually investigate all these other things. Because what happens when you actually look after your kidneys? Well, maybe your diabetes goes away as well, because there's a link between kidney function and diabetes. Maybe your headaches go away. Maybe your weight actually disappears and you actually get down to normal or optimal weight. Maybe you can run faster. Maybe pain goes away. So when you actually look at root causes, you tend to actually solve a whole lot of other problems at the same time. So I hope that all makes sense. If you would like I'm putting together a 7-day meal plan for alkalizing, meal plan for high potassium, a meal plan for low potassium, just in case you have got known kidney problems as well. Then hop on over to Facebook and look for the Health Lab 7. I'll put a link in the description somewhere. Hop on over to Facebook and it'll be in there. You have to request to join and put your email so I can send it to you as well. Okay, be well, and as ever, live long and prosper. You can find out more at beatbloodpressure.com. Be well.